All right, good afternoon. Welcome to the Thurston County Board of Health special meeting for this Tuesday, August 2nd, 2022. It is 4:01 p.m. My name is Ty Menser. I'm chair of the Board of Health. We have Commissioner Gary Edwards to my left, and we have Council Member Robin Vasquez, who will be introduced shortly as our new member of the Board of Health. We are calling the meeting to order, and the first thing we should do is look at the proposed agenda. And is there a motion regarding approval of today's proposed agenda? And I'm going to look to Commissioner Edwards.
Yes, I would move to approve the agenda for today, Tuesday, August 2nd, 2022.
We'll wait while Commissioner Edwards gets mic'd up.
Okay, how are we doing now? Yes, Chair, I would move to approve today's agenda for our special meeting, August 2nd, 2022.
Is there a second?
Second.
A motion has been made and seconded to approve the proposed agenda for today's meeting. Any discussion on this motion?
No, sir.
I'll call for the vote.
Commissioner Edwards?
Aye.
Commissioner Vasquez?
Board member.
Aye.
Is the title?
Oh, board member, my apologies. Commissioner Benser?
Maybe we should all be board members, but we'll figure that out. Aye. Okay, so that motion carries, and I also want to lay on the record, Commissioner Mejia is excused today. We have our county health officer, Dr. Abdul-Malik, on Zoom. We have a prosecuting attorney, Jane Futterman, who is assisting the Board of Health with some of the issues today, present by Zoom. And the motion carries. Agenda is approved. The first item is introduction of new Board of Health member, Lacey City Council member Robin Vasquez. And Kurt, why don't you?
Commissioner, Councilmember Vasquez as the commissioner for the cities on the expanded Board of Health. She comes to us from the city of Lacey, and this is her first board meeting, and we're working through a couple of different areas, but such as titles. And but Councilmember Vasquez, did you want to say a few words as part of an introduction?
Sure. I'll keep it very brief. I'm Robin Vasquez. I use she, her pronouns. I'm a Lacey City Council person. I'm excited to be a part of the Board of Health and help steer and offer support for public health in Thurston County. Thank you for having me.
Commissioner Edwards, any words of welcome?
Well, I'd just say welcome aboard.
Yep. And
Thank you.
Councilmember Vasquez, very pleased to have you. Is under the board's charter, the resolution establishing this expanded Board of Health, which was a requirement of the state law, but had some flexibility to set at a local level. And what we chose to do is add a seat for a municipal elected official, which will rotate between the different jurisdictions in Thurston County and two-year basis, with Lacey being the first jurisdiction to serve for the next 2 years. So we're pleased to have Robin, and we do have 4 more members to add to this board. One will be appointed by the American Indian Health Commission, and we're waiting for that appointment, which could come at any point. And then 3 members will be needed to be selected from the public, and we're going to describe that process. We're kind of partway through it, but we're going to be making some tweaks based on new state requirements, and we're going to go through that in the second item on today's agenda, substantive item, which is item 3. Healthcare and community member recruitment process. And Kurt, you've got a PowerPoint, I believe?
Correct, and Jamie's going to pull it up.
Okay, we'll go through this, and then the board members can ask questions when you're done.
The revised Board of Health The revised Board of Health falls under and was changed based on by the legislature in 2021, and it came out codified in RCW 70.05.030 and WAC 246.90, and prescribed the method for the Board of Health and the expanding of the Board of Health. That went into effect on July 1st, 2022. The Thurston County Board of County Commissioners took action in April with their resolution that's already been referenced by detailing the different positions on the expanded Board of Health and who would make up that expanded Board of Health. Also, the Board of County Commissioners prior to July 1st did some outreach and messaging for applications for the Board of Health, but now as of July 1st, with the new law going into effect, the Board of Health will have to take over that process, and we'll go through the steps for that now. Now, the expanded Board of Health consists of 8 members. They include county and city elected officials. There's 3 members from the Board of County Commissioners. That's Commissioner Mejia, Commissioner Menser, and Commissioner Edwards. 1 member from the cities, an elected official, and that's Council Member Robin Vasquez from Lacey. A travel representative, as mentioned earlier, that will be appointed by or selected by the American Indian Health Commission, and that's forthcoming. And then 3 healthcare and community members to be selected. So the Board of Health for the recruitment process, as specified under WAC and RCW, must actively recruit applicants for the healthcare and community member positions in a manner that solicits a broad pool of applicants that represent a diversity of expertise and lived experience. And we'll go through at the end of this, we'll have a proposed next steps for all of this, but this is the background on what needs to be done. Also, the Board of Health has to provide reasonable advance notice for applicants to apply for these vacancies, these 3 vacancies, and then post the vacancy announcement in public places, in the newspaper of record, and in all geographic regions represented by the Board of Health. Also, make vacancy announcements available in any language upon request, and work with local community organizations to distribute vacancy notices. So the process, all applicants, and you can see this up here at 4 bullet points, but all applicants for the non-elected positions shall be interviewed by a panel formed by the Board of Health. But in the event of substantial number of applicants, the Board of Health may elect to interview a smaller number of applicants as long as those interviewed include a diversity of expertise and lived experience. Talking with Jane Futterman, the legal advisor for the Board of Health, that's a determination by the Board of Health to determine the number of applicants and the number of people they want to interview for the process and what is deemed as a significant number. The interview shall consist of a standard set of questions and may include follow-up questions if necessary to understand the response to a standard question. The Board of Health shall refer the selection to the clerk of the Board of County Commissioners for the consideration of appointment. The referral shall include the selected applicant's completed application and cover letter if of interest. And then the last piece is this: a healthcare and community member shall be approved and appointed by the majority vote of the Board of County Commissioners. So the Board of Health shall assess the following when considering applicants for the selection and appointment: their service, current or past, on other local boards or commissions, whether the applicant's background meets the criteria of the healthcare and community member category for the position of the Board of Health, and then also if there's any potential conflicts of interest as prescribed by the WAC, demonstrated commitment to public health, then whether the applicant represents a diversity of expertise and lived experience, and then whether the applicant represents the geographic diversity of the community, and then when considering applicants representing the category of consumers of public health, whether the applicant identified with a historically underrepresented community. So the criteria for the non-elected Board of Health members, all members of the Board of Health must be Thurston County residents. Healthcare and community members cannot be elected officials. And then the tribal representative, as we already mentioned, is selected by the American Indian Health Commission. And then the 3 members that are approved and appointed by the majority vote of the Board of County Commissioners, these are the 3 different categories: a member representing public health, healthcare facilities and providers, that's category 1. Category 2 is a member representing consumers of public health. And then category 3 is a member representing other community stakeholders. So the first category, category 1, a member representing public health, healthcare and facilities and providers. These are the criteria under category 1. A member must be a person practicing or employed in the county from any of the following categories: medical ethicist, epidemiologist, experienced in environmental public health or the equivalent, community health workers, holders of master's degree or higher in public health or the equivalent, employees of hospitals located in the county. And then the last category for this, last area for this category is it'd be one of the following providers holding an active or retired license in good standing under Title 18 RCW, which includes physicians or osteopathic physicians, advanced registered nurse practitioners, physician assistants or osteopathic physician assistants, registered nurses, dentists, naturopaths, and pharmacists. So that's category 1. Category 2 is a member representing consumers of public health, and this paragraph is what constitutes the criteria for category 2. This category consists of county residents who have self-identified as having faced significant health inequities or having lived experiences with public health related programs such as special supplemental nutrition program for women, infants, and children, supplemental nutrition program, home visiting, or treatment services. Individuals from historically marginalized and underrepresented communities will be given preference. These individuals may not be elected officials and may not have any fiduciary obligation to a health facility or other health agency and may not have a material financial interest in the rendering of health services. And then the third category, a member representing other community stakeholders. This category consists of persons representing the following types of organizations located in the county: community-based organizations or nonprofits that work with populations experiencing health inequities in the county, active, reserve, or retired armed services members, the business community, and the environmental public health regulated community. So the next steps that are proposed is August 3rd, tomorrow, reissue the recruitment with expanded outreach and a goal of attracting additional applicants using the reformatted application. And the reformatted application recommendation is to keep the same application and have a supplemental questionnaire that answers all these questions that were just posed in the presentation here. Then August 19th, the recruitment closes at noon on August 19th, which is a Friday, and then forward the applications to the Board of Health members by 5 p.m. that day. And then proposing on August 24th, schedule a special Board of Health meeting to consider which applicants are selected for a panel interview. And then on August 29th, proposal to schedule interview panel, to have a scheduled interview panel. And then the Board of Health formally recommending final selections to the Board of County Commissioners for appointment. So in a nutshell, that's the process and then the recommendations for the Board of Health to consider.
Okay, let's stop right there. Questions? Councilmember Vasquez, if any.
Do I look like I have a question?
No, we just, I mean, we got in the habit with the Zoom of just kind of asking people one by one, and you just decline if you don't have a question.
Yeah, I think one of the key questions is whether county staff are going to send out another hold to protect some time on the 24th, since I'm guessing we may want more than an hour, depending on how many applicants we get and how many people we're going to end up interviewing. I'm going to block out some time.
Right. If the Board of Health accepts the August, those dates, we will definitely work with everybody's calendars to get the time for the Board of Health to have a special meeting and then turn around and be able to discuss this. But it'll be more than an hour, more than likely.
Kurt, to give a sense, can you tell us how many applications we had in our first go-around?
In our first go-around, if you give me about 30 seconds, I can pull that up and let you know.
Yeah, it was 10 or 12.
Yeah, it was about a dozen.
Total. The problem was they didn't, and again, this is all just to give you a sense, because this is not valid because we didn't do the required interviews and but we did some preliminary discussions using our old process, and we had quite a few applicants for category 1, almost no applicant that perfectly fit category 2, and then like a couple that were out of 2 to 3, I think, for category 3. So that was kind of the scale of what we got first time around. Now we may get, twice that many this time, and we may want to limit who we interview, and et cetera. That'll be the discussion I guess we'll have on the 24th. But just wanted to give you a sense of what we got the first time we tried to recruit.
Jamie counted, and we actually had 11, so between 10 and 12 is actually 11.
Perfect, 11. Okay, and Commissioner Edwards, any questions about the PowerPoint? And
Yes. Kurt, this probably is a question for you under process on number 4 of your slideshow. The 4th bullet down, healthcare community members shall be approved and appointed by a majority vote of the Board of County Commissioners. I'm just wondering, is that verbiage right out of the RCW, or is that something that you've looked at?
So I am going to punt that one over to our legal advisor because I believe it's directly out of the WAC, but I'm going to let her talk to that one.
And let me just tell you.
So if I could a second, I cannot hear Commissioner Edwards at all. I'm not sure if it's the microphone's cutting out or something, but I can hear everybody else.
Flip it on, Commissioner.
I'm
Flip it
not
on.
following the rules very good here, Counselor. Can you hear me now?
Barely. It's as if your microphone's not on
Wow.
and you're just picking up on the
Normally,
room.
people don't have a hard time hearing me,
Right.
so
So let me
Okay,
restate.
that's a little better.
is that better?
Yep.
Yeah.
Move it up a
Just
little
turn-
more.
Yeah. Okay.
Okay.
Okay. So I did not hear it the first
Okay,
time.
so let me restate Commissioner Edwards' question on process. It says, healthcare and community members shall be approved and appointed by a majority vote of the Board of County Commissioners. It's the 4th bullet on slide 4. And Jane, his question was, is that our interpretation, or is that laid out in the RCW or the WAC, or is that a process that we developed by staff?
That's it.
It is laid out, and I can pull the exact wording. So the wording.
And Jane, I'll tell you
Yes.
why I'm asking that if it's not out of the RCW.
It's in the WAC, in the WAC 246-90-030, it says, and I'm reading from it, non-elected members of a local board of health shall be approved and appointed by a majority vote of the Board of County Commissioners. So it is directly in the state regulation.
Right, that's the non-elected ones. What I'm wondering about, I'm told that Robin is a member of this board as of right now. She's an elected official from Lacey. And I'm wondering why she wouldn't be one of the elected officials as a member of this board that is making that appointment. It says county commissioners. I just wonder why it says that, being she is now a member.
Right, so perhaps Jane could speak to the part of the WAC that says the duties of the Board of Health and how the Board of Health refers to the county commissioners.
So let me make sure I understand your question. Were you asking me why the city representative is not being appointed by the Board of Health?
No.
Or the Board of
I'm asking how come she's not also one of the members? I mean, it says by a majority vote of the Board of County Commissioners. If she's already on there,
Oh, I see what you're saying.
why shouldn't she have the same authority that we do?
To a point.
Okay, so you're sitting right now as the Board of Health.
Yep.
And as the Board of Health, under both this new law that went into effect and the state regulation in the WAC that went into effect, the recruitment, the selection, the interview process, that whole process to identify the new members of the Board of Health is to be done by the Board of Health. Now, currently, as of July 1st, the Board of Health, our Board of Health has 8 positions, which are the 3 county commissioners, the City of Lacey representative, Ms. Vasquez, and Then the American Indian Health Commission selected tribal representative, and then the 3 community members. Our Board of Health is mandated to select those 3 community members. So the Board of Health has to conduct this whole process to identify and select it. And then once you've selected the specific person that you select for each of those 3 positions, you send your selection to the Board of County Commissioners to vote and appoint. So it's really the county commissioner's position. The role of the county commissioners is just to either approve or decline to approve a selection made by the Board of Health. If for some reason our county commissioners sitting in that board choose to appoint someone selected, it would go back to the Board of Health to then conduct whatever additional process needed to be to maybe send another member that they select. So the Board of Commissioners has a very limited role, but it's a different role than the Board of Health's role in selecting and recruiting for those 3 positions.
Oh, okay, I'm okay with that. I was just trying to include our new member.
Understand?
Right, and we don't know why the state of Washington chose to set the process up this way, where the Board of Health makes a recommendation to the Board of County Commissioners.
Isn't that just the first, am I right, or am I mixing this up with another board? But isn't it just the county commissioners get to approve, and then in the future, the Board of Health actually does the appointment? And it does no longer go in the future back to the Board of County Commissioners?
According to WAC 246-90030, subparagraph 1, non-selected members of a local Board of Health shall be approved and appointed by a majority vote of the Board of County Commissioners.
Okay.
Always. So it's in the WAC.
That's just the law. We don't really know why.
Well, I could address that a little bit. And I think what the legislature was trying to do was have consistency with these appointments with all the different kinds of boards of health we have throughout the state. So whereas in our county, our Board of Health has been historically the same 3 individuals as the Board of County Commissioners. In many areas of the state, there may be a health district, which is a separate governmental entity from the county. There may be a multi-county or a city-county Board of Health. So there are many different configurations of boards of health, but in each case, the Board of Health does the selection and recruitment, and then the ultimate appointment goes to the Board of County Commissioners.
Okay.
It just seems a little strange because of the way our makeup, where historically we've had the same 3 elected officials serving in both roles.
Okay, it was just a technical question, that's all. Thank you.
So, I don't have any real questions on this process because I was part of the meeting to kind of lay this out, but I would just want to say, because it's our first meeting as the Board of Health in this format, and Councilmember Vasquez with us, that we've got to get this board filled out. And so this is really our priority. Once we have the positions filled, then we have some other items of business to do, which is how we're going to set agendas, how we're going to, when we're going to schedule our meetings, because traditionally the boards of health have been Tuesday afternoons immediately following Board of County Commissioners. That's not going to work for 3 different reasons. So we're going to need some good discussions about just how this board's going to operate. But I think we can all agree that those discussions are premature until we've seated the rest of the members, because we want their input on those various questions. So that's why we're kind of having this unusual meeting today, where we're just focused on this process and trying to move this forward in the right way. And we felt this was about as aggressive of a timeline as we could lay out and still respect the goals of this administrative code provisions to do a robust process, ask the right questions. My understanding is that we're not going to ask the previous applicants to reapply. We're just simply going to ask them to answer the supplemental questions, and our attorneys are preparing that. Is that correct, Jane?
Yeah, that's correct. And we're going to ask the applicants who already applied that supplemental question they need to fill out. And then we're going to re-advertise the application plus the supplemental questionnaire for any new applicants.
For any new applicants. Okay, I just wanted to throw all that out because that was part of our discussions this last month. Go ahead, Commissioner Edwards.
Are we going to be required to have a new election and elect a new chair of this board and vice chair.
I think we will.
And is that farther down the road, or usually that's at your first meeting of a new event? So, I mean, if that's the case, I'm going to nominate Ty and Mahia before this train runs into me. No, I don't want, just so you know that.
I was going to say, it's up to the board, I believe, and Jane, correct me if I'm wrong, but it's up to the board to determine if you want to wait until you fill all the positions of the Board of Health before you decide to have an election for a chair and a vice chair, or if you want to try to do it now, because you do have a quorum, but that's up, I think the Board of Health has to make that
I
determination.
mean, I would not go any further than saying I could be I could potentially be appointed to serve until we're able to fill the board and discuss, and I would accept that, or I think that's probably the default anyway, but.
Okay, then, and that goes along with your question just a few moments ago about how we do the agenda and stuff. Mm-hmm. To me, that is up to the chair to set that agenda or whatever. I mean, kind of the way we've been doing it all along. I don't see that we need to make a change. We could make a change later on if the body decides they want to do something different, but I don't know if we're trying to, we are trying to meet the legalities of the law. And so, well, if that's what it takes, there's 3 of us in attendance and we can do an election right now. If we needed to temporarily, is okay with me.
But the lawyer's not telling us we have to do that. And the intent is to just kind of keeping things status quo for the time being, and we can set that aside. But I guess the one thing I'd point out, and I'm saying this because Councilmember Vasquez doesn't necessarily know how we do business, I would work with the administrator of the Board of Health to set the agenda, but then we would bring that to the county commissioners' agenda settings at 9 a.m. on Tuesday to review and get input from the other board members. That's not going to be able to happen because you won't be at those meetings. So we're going to need an understanding about what the new process is, whether the chair just has the authority to set the agenda, or whether we, that's how it is on most other commissions. Councilmember Vasquez, your hand is up. Go ahead.
I was just going to ask if you wanted a motion regarding specifically the plan laid out in the PowerPoint.
Kurt, do you think we need to make a motion to bless this process?
I would request that you do a motion so that we have formally moving forward, and unless I see Jane say otherwise.
Okay, I would be ready for a motion then, if you have one.
So I'd like to move that we approve and adopt the process and timeline laid out in the Board of Health presentation that we saw today.
Second.
Motions have been made and seconded to approve the timeline and process as laid out in today's presentation. Any discussion on this motion?
No, sir.
Hearing none, I'll call for the vote.
Board Member Vasquez?
Aye.
Commissioner Edwards?
Aye.
Commissioner Menser?
Aye. And we started doing roll call votes kind of mid-pandemic, just for clarity of our minutes and stuff. I know that's different than other accounts boards, but you'll get called out to vote on each thing. Okay, great.
Yeah, I'll get used to it.
Okay. Okay. That's the last business item. Kurt, did you want us to address anything else?
That was all that I had other than answering questions, and then we will work with calendars to set the next meeting, a special meeting of the Board of Health until the Board of Health can determine a recurring meeting schedule.
Anything else for good of the order then from any board member?
I don't really have anything. I just want to make sure we get it right so that the chair can set the agenda if need be or whatever.
Okay.
That's my only other concern.
Well,
And it's not really a concern.
Yeah, I mean, I think Jane, correct me, I will continue to serve as the chair of the Board of Health, provided there's not a motion to make a change there. We don't.
Yeah, I would agree with that. And I was trying to quickly pull up the old RCW, because my recollection in the bill that passed last year that just went into effect July 1st, HB 1152, it added language that says at the first meeting of the Board of Health, the chair is to be appointed, is to be selected from the Board of Health. But I believe that language was really just moved from a different place in the RCWs, and that language has always been there. So I don't see the selection of a chair as being a new requirement. However, I agree with you that when you're going from a 3-member board to an 8-member board, it would make sense to revisit that issue with the whole new board. So I think, yes, I would agree that you continue to serve until the matter's brought up by the membership, or it's on the, you place it on the agenda to relook at that issue and have the fully complemented board determine who should serve as the chair.
Okay, based on that advice, we'll just adjourn today's meeting because we've concluded the business items, and we will be back most likely on August 24th.
And I do have one informational item.
Go ahead then.
Okay. So while SOLFO has sent out a notice, we got it today, and apparently it may have gone out earlier, but we weren't on the distribution list, for a local Board of Health orientation on August 31st and September 1st of this month, the end of this month, in Spokane, Washington. I will send this email out. This is to individual members of the Board of Health, and it appears that while SOLFO is covering the cost of this, but it's determined whether or not the local Board of Health members yourselves are able to attend. And then if you are, we'll let you do the registration and process.
Can you repeat the dates?
Yes, it's set up for August 31st and September 1st.
Oh,
It'll
like
be overnight in Spokane.
1 2-day event.
Right, starting at 11 a.m. on the 31st and concluding on the 1st at noon. And I will send out this email notification to all the members.
Okay, and that's going to be
Thank you.
hard for us to, we're interviewing people on the 29th. That's going to make it hard for them to attend, but maybe it'll be available virtually and, or like recorded, or they would provide that for, we could ask folks to watch key sessions. I don't know. Let's get more information about that if we can.
Well, okay.
Well, isn't that the Friday before a 3-day weekend? Before Labor Day?
It is the week before.
Yeah, it's a Wednesday and Thursday though,
It's a Wednesday and a
Oh, it's a
Thursday.
Wednesday and Thursday.
prior to the
Oh.
Labor Day weekend.
Yeah.
So I'll be honest, with all these changes and all the different jurisdictions, I'm inclined to try to attend that myself. I don't know if I'll continue to be the chair, but whether I am or not, I'll make a priority on this, because I think I could, if nothing else, I could bring back information for everybody else and share what I learned, if I'm the only one that can go. But I think that sounds like a very useful session.
Okay. We'll
Treat
get
it
the
like a
information
train
out.
the trainer.
Yeah, exactly.
Yeah, we'll get the information out to everybody.
Okay, very good. With that, we're adjourned. Thank you.